Hi, in this video I'm going to be demonstrating how to assess a pulse rate and a respiratory rate in individuals. So to start out, I'm going to take my patient's arm and I'm going to find her radial artery. It is on the anterior side of the forearm and it's on the radial side or the thumb side. So I'm going to take my first two fingers and not my thumb because my thumb has a pulse itself, so it could interfere with me reading her pulse. So on my first two fingers, I'm going to lightly palpate until I can find her pulse. And once I find it, I'm going to count how many beats happen in 30 seconds. You can use 15, 30, or 60 seconds, but I like to use 30 just because it's more accurate than 15, but it's faster than 60. So I like to use 30. So once I find her pulse, I'm going to start my timer and count. Okay, so I counted 35 pulsations in 30 seconds, so multiply that by 2 in order to get the beats per minute, and so 35 times 2 is 70, so she has 70 beats per minute, which is completely normal for her age bracket. And so next I'm going to do the respiratory rate, and so to do this I'm going to keep my fingers on her radial artery and move her arm just right here. I'm going to do this just to kind of trick her so she doesn't know that I'm counting her respiratory rate. If you tell someone I'm going to count how many beats how many breaths you're taking, they could start breathing differently. So to do this, I'm going to put this right here and I'm going to be watching her chest and feeling her respiratory cycles, and I'm also going to count again for 30 more seconds. Okay, so I counted 10 breaths, complete inhale and exhales. So again, times that by 2, which would be 20. So she had 20 breaths in a minute, which again is completely normal.